Biotech companies are working on a new class of drugs to treat migraines. And believe it or not, the science has a little something to do with spicy food. Bloomberg's Olivia Sterns is here with more. Olivia, first, what's the connection between migraines and spicy food, or fixing migraines and spicy food?
Okay, well, believe it or not, migraines and chili peppers actually have a lot in common. And what I mean by that is if you actually want to go ahead and rub a little chili oil into your skin, what happens is very similar to what happens when a migraine attacks. So what happens is the skin releases a pain signal, an amino acid that sends a message to your brain saying, ouch. And the idea is this whole new class of drugs is focused on actually blocking the pain signal, so stopping the migraine in its tracks.
And have they used chili peppers in effect to teach them how to do that?
No, it's more about understanding the chemistry
So this
of the
is
pain.
a metaphor.
Yes, no, it's about understanding how pain works and stopping the pain of the migraine before it actually flares up into a headache. And a lot of the biggest biotech companies are working on this, including Amgen and Alder, both of them stage 3 already with new drugs to treat it, and it's a huge market. 36 million Americans suffer from migraines. That's nearly 12% of the population, and I didn't know nearly 3 times more women than men get migraines.
That's because women have to put up with men who make their lives difficult, no doubt. Where do they stand on the progress of actually coming up with legitimate drugs that would work?
Okay, well, this is something that the likes of Bristol Myers and Merck have both already walked away from. But again, Amgen is the most promising in the pipeline. One analyst at RBC told me Amgen could make nearly $1 billion off this. It's a huge market already. There are about $3.8 billion worth of drugs being sold for migraines. But did you know you can also use Botox for migraines?
Carl Riccadonna, you're an economist. You probably give people migraines, I would imagine.
I have been accused of giving migraines, but...
And have you ever made the connection that Botox is one way to fix the Carl Riccadonna-induced migraine?
I think there's no cure for a Carl Riccadonna-induced migraine.
No, but the important thing to take away here is that the success of Botox in treating migraines demonstrates the market potential. So another analyst told me that Botox could bring in $1 billion just for chronic headaches alone.
And I guess, by the way, if we're just connecting the dots, Botox you use typically to stop wrinkles in your brow. It relaxes the muscles, and I guess it effectively does the same thing. It creates a blockage.
Exactly. It creates a little bit more room up there. You would get more than 30 injections. You have to go every couple of months, and the idea is this alleviates some of the pressure of the migraine.
Ooh.